in Cookeville, and this is Olivia and Kendall at 6:04 in the morning, coming to you with pregnancy news. I'm going to start out with some information about preconception nutrition. For women who are trying to get pregnant, weight should be of the concern. For women who are trying to get pregnant, the weight is a utmost concern for fertility. Obesity and underweight both increase the likelihood of reproductive health issues. Central obesity interferes with reproduction in both men and women. The first choice for treatment in infertility for obese people should be weight loss. We can focus on lifestyle changes, decreasing calorie intake, and increase physical activity levels. Weight loss surgery may be required. That is called the bariatric surgery. Now, the bariatric surgery helps with taking the weight off of the woman. Infertility may return after surgery. Some of the risk with this surgery is that pregnancy is not recommended after the first year of the surgery. Some other problems associated with preconception nutrition: diabetes prior to the pregnancy, high blood glucose levels during the first 2 months of pregnancy are teratogenic to the fetus. It is associated with a 2 to 3-fold increase in congenital diabetes in newborns, malformations of pelvis and heart seen in newborns, and higher rates of miscarriage. Gestational diabetes is a type of diabetes that is considered to be a form of type 2 diabetes. To prevent this during pregnancy, there should be a pre-pregnancy weight loss for the woman, increased fiber intake, and exercise. And exercise reduces the risk of gestational diabetes.
Carbohydrates are used for the fetal brain's need for glucose. Average intake of 45 to 65% of carbohydrates are needed for an adult. A pregnant woman should consume around 175 grams, which is 700 calories from her daily diet. Foods such as whole grain products, fruits, and vegetables are excellent choices for carbohydrate foods. A protein recommendation during pregnancy is 71 grams. Protein increases during the course of pregnancy due to protein tissue accretion. Around 2 pounds of protein is accumulated. This is given out to the fetus, maternal blood, and extracellular fluid volume, uterus, and placenta absorption. Fat provides essential fatty acids that are required for fetal growth and development. 33% of total calories should come from fat sources. Other minerals and vitamins are essential during pregnancy. Adequate intake of folate increases fetal growth and fewer complications during the pregnancy. Vitamin A is important for cell differentiation. Vitamin A deficiency that occurs early may lead to malformations to the fetal's lungs, urinary tract, and heart. Approximately 300 micrograms of calcium is needed daily. This is relevant to about 3 cups of milk. The need for iron increases substantially. About 1,000 micrograms of additional iron is needed for a healthy pregnancy. The recommended consumption of 27 micrograms per day will meet the needs for pregnancy.
Vaccinations are recommended before you become pregnant, during delivery, or right after delivery. Having the right vaccinations at the right time can keep you healthy and help your baby from getting sick or having lifelong health problems. Smoking, drinking, and use of street drugs can also cause problems during the pregnancy for a woman and her baby, such as a premature birth, birth defects, and infant death. If you are trying to get pregnant and cannot stop smoking, drinking, or using drugs, get some help. Contact your doctor or local treatment center. All women should be counseled to consume a healthy diet of vegetables, fruits, whole grains, lean meat, poultry, fish, and dairy foods to ensure adequate intake of the range of nutrients important for fertility and optimum health. Some supplements suggested are folic acid, vitamin D, calcium, iron, iodine, also essential fatty acids. Regarding fish consumption, women should be advised to consume 8 to 12 ounces of a variety of seafood weekly. However, due to high mercury levels in some fish, we should limit consumption for the woman in small doses. Overall, for preconception nutrition, women should have a healthy, balanced diet, take supplements, and get a minimum of 30 minutes of exercise a day. Olivia?
Nutrition through pregnancy. Consuming a well-balanced and adequate and helpful diet during pregnancy is important for both the mother and the child. Decreased rates of congenital malformations and fetal growth restriction have been found to be associated with high-quality diets during pregnancy. Each person in pregnancy is different, so I'd advise an expecting mother to consult with her dietitian for specific diet recommendations.
On to Devin and Monica.
Thanks, Kendall. Obesity while pregnant. Obesity associated with higher rates of stillbirth, C-section delivery, large for gestational newborns, and type 2 diabetes. Recommendations and interventions: meet nutrient needs, consume a variety of basic food, participate in physical activity. Obesity makes you more prone to hypertensive disorder. Women who have had any hypertensive disorder in pregnancy have increased cardiovascular risk with each condition of hypertensive disorder. The pregnancy becomes more risky. Chronic hypertensive blood pressure exceeds 140/90 mmHg before pregnancy, 20 weeks gestation. Gestational hypertension is after the 20 weeks of gestation. Preeclampsia, high blood pressure, and protein.
Thanks for that info, Deb. We're going to move on to another topic. We're going to talk about the benefits of breastfeeding. Now, specifically, we're going to talk about nutritional benefits first. Human breast milk provides optimal nutrition to infants and matches requirements for infant growth and development very closely. Infant nutrition needs can be met without the need for other foods or water for the infant. Human breast milk also promotes the development of the central nervous system. Some of the other benefits of breastfeeding infants includes immunological benefits. Human milk helps protect against infections, and it can help prevent infections in the gastrointestinal tract as well. It is projected that improving breastfeeding could potentially prevent more than 1 million deaths each year. It also reduces the risk of SIDS, which is sudden infant death syndrome. Additionally, research has shown that there is a correlation between breastfeeding and fewer acute illnesses. Not only is there a reduction in acute illnesses, but also chronic illnesses as well. Chronic illnesses could include, but are not limited to, celiac disease, inflammatory bowel disease, diabetes, and even leukemia. Research also shows that individuals that had a family history of breastfeeding for 3 to 4 months had a reduced risk of things like eczema and asthma. And lastly, breastfeeding, especially continued breastfeeding, has been linked to cognitive benefits. Infants given breast milk showed a higher IQ than infants that were given cow or soy milk-based substitutes.
And that's a wrap for the latest news on pregnancy.